everyone, this is Ben with RegisteredNurseRN.com, and in this anatomy lesson I'm going to discuss flexion and extension, which are body movement terms that either increase or decrease the angle between two structures, moving them either closer together or further apart. Now in anatomy, flexion and extension are known as angular movements, and I find personally that it really helps to think in terms of angles because flexion is going to decrease the angle between two structures as they bend or move closer together, whereas extension is going to increase the angle between those structures as they straighten and move apart. So let's take a look at some examples of flexion and extension. Elbow flexion, also called forearm flexion, occurs when the angle between the forearm and arm decreases, allowing the ulna of the forearm to move closer to the humerus bone of the arm. In contrast, elbow extension, also called forearm extension, occurs when the forearm moves away from the arm, increasing the angle between those bones. Shoulder flexion, also called arm flexion, occurs when the angle between the humerus of the arm and the scapula decreases. In contrast, shoulder extension, also known as arm extension, occurs when the angle between the humerus of the arm and the scapula increases, causing the arm to move posteriorly. And the joint here allows posterior movement past the anatomical position. Flexion of the wrist, also called hand flexion, occurs when the angle between the palm of the hand and the anterior surface of the forearm decreases, while extension of the wrist, or hand extension, is moving the palm of the hand away from the anterior surface of the forearm. Hence, the angle increases as it continues to move beyond the anatomical position. Finger flexion occurs when the angle between the anterior surface of the fingers and the palm decreases, and when the angle between the fingers and the palm increases, finger extension occurs. Flexion and extension can also occur within the interphalangeal joints. Now, as you can tell up to this point, most of the movements with flexion and extension are going to occur within that sagittal plane or parallel to the sagittal plane. However, with the thumb, it's a little bit different. Thumb flexion is going to have the thumb moving toward the pinky, kind of parallel to the palm within that frontal plane, and thumb extension is going to have the thumb moving away from the pinky. And if you think of your palm as a windshield and your thumb as a windshield wiper, it's going to kind of go back and forth in that kind of a motion. Flexion and extension can also occur at the interphalangeal joint of the thumb. Next, we have hip flexion, also called thigh flexion, which occurs when the angle between the femur of the thigh and the hip bone decreases as the thigh moves anteriorly or forward. Hip extension, or thigh extension, occurs when the angle between the femur and the hip bone increases as the hip joint straightens. And just like the shoulder joint, this joint also allows movement past the anatomical position. Knee flexion, also called leg flexion, occurs when the tibia bone moves toward the femur, causing the angle to decrease between those two structures. Knee extension, or you could say leg extension, occurs as the angle between those leg bones increases, causing the leg to straighten. And just like the fingers, toe flexion and extension can also occur. Vertebral column flexion, or spine flexion, occurs when the angle between the trunk and the hip joint decreases, and spine extension occurs as the spine straightens. Neck flexion occurs as the angle between the head and the trunk of the body decreases, whereas neck extension occurs as the head moves away from the trunk of the body, and the neck is another one of those structures that can continue posteriorly beyond the anatomical position. The vertebral column can also experience flexion within that frontal plane. For example, if you bend the spine to the left or to the right, that's called lateral flexion, and movement back toward the anatomical position is called lateral extension. And then finally, I want to talk a little bit about hyperextension, because whenever a structure moves beyond a certain point, anatomists will refer to that as hyperextension. Now, what can get a little tricky with this is that anatomists will sometimes define hyperextension differently. For example, some anatomists will say that when the arm, neck, wrist, or leg moves past the normal anatomical position in a posterior motion, it actually becomes hyperextension and not just extension. Whereas other anatomists will only consider these movements hyperextension if the movement exceeds the normal range of motion permitted by that joint. Obviously, for test-taking purposes, you'll want to do whatever your anatomy professor says, but I just wanted to give you a heads up about that. Okay, so that wraps up this video over flexion and extension. We have a free quiz that you can take on our website. The link is in the description and comment section below. In addition, we have a whole playlist of anatomy videos that you might want to check out. Thank you so much for watching, and please subscribe.